In the last hour, the Prime Minister announced some new evidence concerning the so-called British variant of COVID-19. That's the B.1.1.7 variant, which we already know is more transmissible than the original virus. The headline is that the new variant, first identified here in the UK, may be associated with a higher degree of mortality. In the press conference, we learned that the British variant is known to be spreading elsewhere in the world as well, including specifically, they said, in Israel, and it transmits between 30 and 70% more easily than the original, but it isn't thought to affect any particular age group more than the previous variants. All this information comes with the strong disclaimer that the data is still currently uncertain and quite incomplete, but it does look like it can be more deadly. The example that they gave in the press conference was that for a man in their 60s, on average, infected with the original virus, around 10 in every 1,000 cases will result in death. But if infected with the new variant, that British variant, the number increases to 13 or 14 deaths per 1,000. So there clearly is some continuing worry about these new variants.
Certainly a concern. And Jonathan, we know that Britain's chief scientific advisor spoke with Israeli experts this week after an Israeli study suggested that the UK vaccine policy could put lives at risk. Tell me, is the UK likely to change its policy?
Here in the UK, many people are extremely worried about the vaccination strategy that's been adopted, because instead of administering the 2 doses needed of the Pfizer vaccine in particular 21 days apart, the decision has been made for both vaccines being used here to wait up to 12 weeks between doses. The vaccine developers have never tested that strategy and advised against it. Now, the government's chief scientific advisor, Sir Patrick Vallance, yesterday had what was called a helpful discussion with Israeli experts about this strategy. And that came after numerous reports here detailing a study released in Israel that tracked people who'd had the Pfizer vaccine. The Israeli data seemed to suggest that after just 1 dose of that Pfizer vaccine, people are not as well protected as has been suggested by the UK authorities. Addressing the Israeli data, here's what Sir Patrick Vallance said in today's press briefing.
We had a discussion with the Israeli advisors yesterday, and they're expecting to get more information over the next few weeks. And I think we're going to have to monitor this very carefully. I mean, we're going to have to keep looking at data and understanding the performance of vaccines in the real world.
The UK has made that decision to allow more people to be vaccinated with at least 1 dose, allowing a greater number of people to achieve some level of protection sooner. So for now, the UK is sticking with that untested plan of extending that gap between the doses, but it is clearly watching carefully as Israel produces more evidence. Many individuals here awaiting their 2nd dose will be hoping they change their minds.
And Jonathan, we are hearing that the UK is considering paying people who test positive. What's going on here, and is that actually likely to happen?
A very strange story that made it to the papers today, that in a particular proposition being considered but not yet announced as a policy, and perhaps it won't make it after the reaction that was given today by most of the public, there was the consideration of offering a £500 payout to anyone with a positive COVID-19 test. Sounds a little bit crazy, but the logic behind it is to try and encourage people to get tested, even if they're afraid they're going to come out positive. Because many people who can't afford to take the time off work and won't be able to make up that money some other way, perhaps people on 0 hours contracts or people without very much to fall back on otherwise, many of them are avoiding getting tested because it means that not only they, but everyone they live with in their house, their families, flatmates, or whoever, will have to go into isolation and lose out from not being at work. So the proposition was made that perhaps they could be paid £500 to encourage them to get the test and then to help them with that cushion in case they lose out on earnings. But plenty of people looking at these suggestions have said that this is not the right solution for a very real problem. Indeed, perhaps some more foolish people might see it as an opportunity to go out and get COVID-19 if they're among those few who believe that it's not really a serious disease at all. And that could have disastrous effects on the nation. So far, the government not announcing that policy, and perhaps they're rowing back on even the idea today.